Hello everyone. Today we're going to talk about schizophrenia. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they've lost touch with reality, which can be really distressing for them and those around them. It's important to understand that schizophrenia is a medical condition and not a personality flaw. Symptoms of schizophrenia. So, schizophrenia has a variety of symptoms that can make everyday life challenging. Some people may experience delusions, which are strong, false beliefs that aren't based on reality. Others might have hallucinations where they see or hear things that aren't there. Disorganized thinking can lead to jumbled or incoherent speech, and abnormal motor behavior might make someone move in strange or agitated ways. Lastly, there are what we call negative symptoms, which include lack of motivation, emotional flatness, and social withdrawal. So, causes of schizophrenia. So, what causes schizophrenia? It's not fully understood, but it's believed to be a result from a combination of factors. So, genetic plays a role. If you have a family member with schizophrenia, your risk is higher. Brain chemistry is another factor. So, imbalances in certain neurotransmitters like dopamine are thought to contribute. Environmental factors such as stressful life events or substance abuse, particularly cannabis, can also trigger the condition, especially in people who are already at risk. Finally, developmental issues such as complications during birth or early childhood years might also increase the risk of developing schizophrenia. So, risk factors. There are certain risk factors that make someone more likely to develop schizophrenia. These include having a family history of the disorder is one of the biggest risk factors. Schizophrenia typically begins in the late teens to early 30s, so age is also a factor. Substance abuse, particularly the use of drugs that alter the mind during adolescence, can increase the risk. And finally, experiencing a lot of stress, especially traumatic events, can act as a trigger too. So, effects on daily life. So, schizophrenia can have a profound effect on daily life. People with this disorder might find it hard to maintain relationships because of social withdrawal. They might struggle to keep a job or stay in school. There's also an increased risk of self-harm or having suicidal thoughts. Even basic self-care tasks like getting dressed or eating can become extremely difficult. So, treatment. Fortunately, schizophrenia is treatable, and many people with the disorder can lead fulfilling lives with the right support. Medications, particularly antipsychotic drugs, are often prescribed to manage symptoms. Therapy, such as cognitive behavioral therapy, can help cope with the symptoms and improve their quality of life. Support from family and friends is really important, and so is education about the disorder. Some people can benefit from rehabilitation programs to help them regain skills, and in severe cases, hospitalization might be necessary to stabilize the person. There are several key resources for those affected by schizophrenia. So the NHS offers mental health services where you can get a referral to a specialist and access treatments. Mind, a major mental health charity, provides comprehensive information, support, and a helpline for individuals requiring assistance. Rethink Mental Illness provides advice, support groups, and services specifically for people living with schizophrenia. Another valuable resource is SANE, which provides emotional support through their helpline and online forums. So these organisations are here to help. So it's important to reach out if you or you know someone that needs support. So in conclusion, schizophrenia is a serious but manageable condition. With the right treatment and support, understanding the disorder helps reduce stigma and supports those who are affected. And of course, if you recognise the signs in yourself or someone else, you should always reach out for help. Thank you for listening.